Well, it's coming up, Drug Take-Back Day. So it's a really good time for us to review the proper way to dispose of old, unused, or expired prescription medications. So here to help, pharmacist John Dobbins from UConn Health Center. Good morning to you. Thanks for coming in.
Good morning, Kerri-Lee. Thank you for having me.
Well, first of all, why is this so important? Why do we need to get this right?
Actually, two reasons. First is for a clean, safe water supply. We're flushing things down the toilet, and eventually that ends up going into our water supply. So if we put medications down our toilet, our sewers, our septic systems, eventually it could reach the water that we drink. And
then we get medicated water,
exactly,
which we don't want.
Which we don't want. And the other thing is for safe streets. We know that our teenagers are very inquisitive, and about a third of all new prescription drug users are teenagers between the age of 12 and 17, and they choose prescription drugs as their first choice before they go on to other things.
So we've got to get them out of their hands.
If we can prevent that in farm parties, it'll go a long way to preventing that drug abuse and anything else that may happen as a result of that.
So how rampant is this? I mean, would you say the majority of people are doing this wrong? They're not thinking about it and down it goes to flush of the toilet?
You know, I've been a pharmacist for 30 years, and we were actually taught in school that's what we do with the prescription meds, is actually discard them down a toilet for various reasons. We know that that's not true now, and the best method is actually by incineration. And take-back programs like this that we're having on the 29th of September, National Take-Back Day, all the meds that are brought back to us will be incinerated. Nothing will be used at an EPA-approved facility.
So there it is. That is the proper way to do it.
Yes.
And, you know, I was going to ask you, how often should we go through our medicine cabinets? But if this program's going on twice a year, maybe that's a good way of looking at it.
Actually, this is a good spring and fall cleaning. You know, you never know. You'll have relatives that, may for some reason not be living in their house anymore. You know, going and cleaning out their medicine cabinets and bringing them to programs like this. I mean, I know my mother, my parents are both still alive, and every year I get a bag of meds from them to, to take care of, to get disposed properly.
We're all guilty, right? We're all contributing.
Yep.
And I thought it was interesting to know we're not just talking about people meds, we're talking about like veterinarian medicines as well. So can you give us a rundown of what we're talking about here?
Sure, it's the whole host. It's not only your prescription medications, but it's your over-the-counter medications, cough and cold supplements, veterinary meds, which some of the surveys that we've done are about 5 to 10% of the volume that we take in is actually veterinary meds.
That's significant.
It is. Nutritional supplements, vitamins, the like, and inhalers, things like that.
All right, so let's help people get rid of their meds the right way.
Definitely.
It's coming up on the 29th. Bring your meds, whatever they may be, to the UConn Health Center, right?
That's correct.
The time is 10 a.m. to 2 p.m. And I think the best part here is, you know, it doesn't matter if it's rain or shine. You don't even have to get out of your car.
Exactly,
right?
and it's free.
And well, that's the other great part.
Yes,
yeah.
yes.
All right. So thank you so much for coming in. It's a good reminder for all of us. John Dobbins, thanks so much for sharing that information. We'll see you on the 29th.
Thank you.
All
See
right.
you. Bye-bye.